Tell me about the hypothesis that you and your colleagues had. What did you look to study?
We want to look at influence of neighborhood conditions on behavioral problem among children. So currently, we usually think about neighborhood's influence in terms of, among adolescents, and usually adolescents hanging around in the street, or the influence of their peers. I think that's also the majority of the research that currently focus on. But we think that for externalizing behaviors or problem behaviors, it could start much earlier. And so we examine the effect of neighborhood conditions on children from early childhood through their teenage years. We looked at a longer time span, we looked at when that effect happens, and we also looked at the role families might play in this relationship.
How many families were involved in the study, and for what period of time?
So we have more than 2,000 families with 3,500 children. So some of the children, they have two children in a family. So, and we follow these children through a 10-year period. So they started when they were between birth and 12 years of age, and we follow them until they're 18 over a 10-year period. So it's a really long period of time given this area for research.
How did you measure the neighborhood quality?
Neighborhood quality is actually measured by one single question, which asks the parents how they would rate their children, their neighborhood as a place to raise children. However, this measure mapped really well with the neighborhood's own poverty rates and the interviewer's observation of the physical condition of the neighborhood, including the dilapidation of the housing unit, the road, trash on the street, or noise on the street, or sign for drug use.
After this period of time, what did you and your colleagues find?
We basically found that children who live in poor neighborhoods, let's say children live in poor quality neighborhood, would have more externalizing behaviors, and that that relationship starts to appear as early as their elementary school years, and that continue to affect them into their teenage years. The other piece of finding is that this effect is mainly acts through the family dynamics, such as parents' mental distress and conflicts within a family. In fact, that two conditions almost entirely account for the neighborhood effect. So it's neighborhood effect act through family dynamics.
You had mentioned the term externalizing behaviors.
Yeah.
Could you explain what kind of behaviors those were?
Sure. So externalizing behaviors is a cluster of behavior that has signatures such as disobedience, impulsivity, aggression, or generally mean to others or telling lies. We have a set of 10 questions that measures these. These are pretty common behaviors to be seen in children, especially young children, but also adolescents. But it is more severe in some children or some adolescents that it constitute a problem for them. And children with externalizing behaviors, usually it affects their academic performances, it affects their peer relationships, and is actually a predictor of later life delinquency or drug use or depression or even crime in some cases. They do track over time. They track very strongly over time. That doesn't say that children who has externalizing behavior cannot improve over time. Sometimes they do, but it depends on their environment. So if there is a change of environment, say if they have improvements in their family relationship or the neighborhood condition, they actually might have an opportunity to improve. The reason why we see these behaviors to track over time is partially because their environment does not change. Yeah, so it does track strongly, but it has opportunity to change.
What are the implications from your findings? What does this suggest?
Well, I think there are several ways we might be able to prevent externalizing behaviors in children. Some of them can be done in the family level. For example, parents who has general psychological distress or depression, anxiety, or family who has conflict might be able to get help from local organizations or service providers to get checked and then to get treatment or counseling. That might be able to stop the the effect of neighborhood by providing more protect at the family level. And on the other hand, I think at the society level, we might be able to provide more assistance for the families to, there are programs that already exist to move poor families out of poor neighborhood. And some of them do see outcomes in, improvement of the parents' mental health and also the children's mental health. But these programs needs to start really early to catch children, because we know it's more likely that these neighborhood effects are cumulative over time. So the longer you stay there, the longer you see an effect. So if we could do that assistance earlier and to more struggling families, we might be able to improve their outcome.
If a parent already identifies that this is a poor quality neighborhood, why would they not take those steps to move out?
I think that's seemed to be a very simple question, but actually it's a very complex one, and many researchers has digged into that and found that a lot of the times families do know that they live in a bad neighborhoods with crime, with bad physical amenities, but they're just not able to move because their rent is so expensive elsewhere, or because they have public access to public transit in their current neighborhood, or that they have relatives who could help with childcare in the vicinity. So it's really difficult for these families to move out. And the other thing is, racial segregation across the neighborhood is very, very severe in the United States. So for example, a racial minority to move out of his or her neighborhood, she or he might face a lot of hurdles. So yeah, it's not easy to move out if you want.
We had mentioned the tips for parents. How about additional tips for communities, for advocates, for people that look at these areas and want to help?
Well, I think they could probably work on at the local level to seek programs to improve their neighborhood environment, such as the basic things, trash or road conditions, just the basic public services that could help to improve. And I think probably you and a lot of viewers could have heard about the broken window phenomena, where you have if you have dilapidated physical condition, it basically gives a message that people in this community does not care. So it actually, the physical dilapidation of the neighborhood is associated with crime and delinquency. A lot of the behaviors, people think that other people are not looking, so it's okay for me to do that. So I think the basic things that could be improved in the neighborhood level, there are a lot. The things that the basic public services, yeah.
Is there anything I didn't ask you that you would want people to know?
I think it is an important thing to know that it is not rare for families to live in poor neighborhoods. In fact, in the year around 2010, 70 million American people live in a poor neighborhood, which is, about 20% of the population in a neighborhood living below poverty threshold. So that's when you see the neighborhood actually has a negative impact on its residents. So 70 million Americans is 1 in 4 Americans living in poor neighborhoods. So it actually affects a lot of people.
Well, you got your undergraduate research and your graduate and your advanced degree.
I got my undergraduate degree in, it's a Bachelor of Medicine degree from Peking University Health Science Center in Beijing. and I did some clinical work. My major is in nursing, but I found that I could probably help more people to prevent disease in the first place if I go into public health. So that's why I go into public health, and I came to study in the United States. I did my master's and PhD program at Johns Hopkins University, focusing on maternal and child health.
How you got interested personally in this line of study?
I lived in, during my graduate school years, I lived in East Baltimore, close to campus, for 6 or 7 years. And East Baltimore, if you know, it's a struggling neighborhoods with high poverty and a lot of crimes. And I actually interact a lot with my neighbors. And they are nice people, but they face a lot of difficult problems. And I see teenagers growing up, even little children growing up on the street. And once I actually heard a gunshot out of my doorstep, and a probably teenager got shot on his back, and then I think I study public health. I should probably study something that I'm familiar with and I really feel strongly about. So that's how I got into neighborhood and children's behavioral problem.